Hi everybody, Dr. Jen here with the Wellness Way in Woodbury. So today we are going to talk about birth control and its effect on immune responses. So we all know that birth control is an endocrine disruptor. So what that means is that it is disrupting all of your endocrine glands. You guys, we look at the Wellness Way as our body as a Swiss watch. So we know that our nervous tissue is the most important organ, or our nervous system is the most important organ, and every single other system revolves around it. Well, if we're disrupting our endocrine system, what do you think that's going to do to our immune responses? It is obviously going to disrupt them. And on top of this, you guys, birth control has so many different long-term effects. It has so many side effects. You guys, look at this. What are some of the potential side effects and reactions listed on birth control? So if you guys aren't reading your medication, these are things that it says. Risk of developing blood clots, ladies. Cancer and reproductive organs or breasts. You guys, cancer is a risk factor of birth control. Change in appetite, gallbladder disease, mental depression, irregular vaginal bleeding. Is that just an inconvenience? It's not an inconvenience. Vaginal bleeding is not fun, especially if you are bleeding more than you have to be. GI symptoms, premenstrual syndromes, liver tumors, nausea, malaise, headaches, dizziness, rash, weight gain. Ladies, how many of you have been on birth control and gained weight? That is so stinking frustrating. Acne, heart attacks and strokes, vaginal infections, change in vision, nervousness, loss of scalp hair, allergic reactions, candida, so vaginal yeast infections, change in libido. These are all things that are listed as potential side effects and reactions. And did you guys know that infertility is sometimes caused because of this? Because what happens is when we are taking birth control, it is a synthetic version of hormone. So instead of our pituitary signaling to our ovaries to tell us to make hormone, what happens is this feedback loop is blocked off. So it is telling your pituitary you have enough hormone and you don't have to make it anymore, because it's either one, telling your body that you're pregnant the whole time and has a consistent amount of, consistent amount of hormones across the board. You guys, no body should be like this. And this is why people, when they get off birth control, say want to get pregnant like this. Ladies, it just does not happen like that. It just does not. Because what happens is our body hasn't been making that hormone for years. And then you need to go and start making that hormone. Well, it doesn't work like that. It really does not work like that. It takes our body a little bit to be able to start producing that hormone again. It has so many negative effects. So it's looking at this as what is the hormones and their role in the immune responses. Well, you know, men and women are completely different. So I'm looking at my notes. So women, we're meant to have babies. Men, we're not meant to have babies. As ladies, that's what our body is for, is to bear a child and have a baby. However, if your immune responses are not functioning properly, what the function of our immune responses is to recognize any foreign tissue and get rid of it. And when you get pregnant, that baby is a foreign tissue. And if it is a foreign tissue, what is your immune response is going to do? It is going to go down and it's going to attack that tissue. And when it attacks that tissue, this is what is causing a miscarriage. Your body needs to respond appropriately to you being pregnant, and your immune responses need to change throughout that pregnancy so that your body does not attack that foreign tissue. Because your body, you guys, is going to protect you and only you. It doesn't care if you have a baby in there. It does not care. If you're in survival mode, it is going to not respond appropriately because there's stresses on your body, which can potentially lead to a miscarriage. But what is birth control doing to our immune responses? You guys, it actually down-regulates our immune responses. So instead of this birth control thing, why don't we start tracking our cycles, knowing when our ovulation is, using condoms? Because if we're decreasing our immune responses and we're on birth control and not using condoms, guess what happens is our risk of herpes go up. Our risk of HIV go up. Our risk of infections all go up because our immune responses are lower. And if our immune responses are lowered, we're not going to be able to recognize that virus or that bacteria or that certain issue as foreign. We're not going to be able to get rid of it. Your body should be able to respond appropriately to these things. But if you're constantly down-regulating or constantly decreasing your immune responses so it can't respond to those foreign tissues, you're setting yourself up for more susceptibility to an STD if you are not wearing condoms and using birth control. So why don't we start using condoms and tracking our periods? Things that don't have side effects, because you guys, these have so many long-term side effects. And you guys, the number one reason why women die is because of heart disease. And this increases your risk of heart disease. This increases your inflammatory marker from 0.7 to 5. It's about 5 times higher. Birth control pills are increasing your inflammatory markers. We like to see this below 1. When it gets above 3, it's a high risk of cardiac events. Why do you think it says risk of developing blood clots? Why do you think heart disease and heart attacks are at an all-time high? Because birth control is at an all-time high, you guys. We need to change our thinking, and we need to figure out where the stress is on our body instead of just running right to birth control, instead of running right to these things because we have a hormone issue. Maybe there's all these PCOS, endometriosis, infertility, for all these matters, fibroids. Their go-to is putting on birth control. So why is your body responding this way? Where is the stress on your body? Is it hormones always respond to something else that's going on? Is it your gut? Is it food allergies? Is it blood sugars? Is it inflammatory response happening in your body where we need to figure out where that stress is that's causing it? This is how we need to start thinking about it instead of just putting a pill on it, because this affects your immune responses. So if you guys have any questions, shoot them in the comments. I will answer them for you. I'm just going to take a minute and say hi to everybody that's on. Hi, Stacy. Hi, Amber. Hi, Maria. Hi, Lisa. Hi, Miranda. Hi, Dr. Miranda. Hi, Dr. Jenny. Hi, Ben. I hope everybody's doing well. I know I just went on a little rant there, but I really want you guys to understand what birth control is doing to your body, because it is an endocrine disruptor and it is going to disrupt everything, and it disrupts other systems in your body, ladies. And especially if you want the chance of being pregnant one day, being on birth control could potentially hinder that and make it a lot more difficult to be able to conceive than it would have been prior to that. So thank you guys, everybody, for watching. On Thursday, actually, we're going to go live a little bit earlier than 1 o'clock. I am probably going to go live around 11:30, 12 for Ask Dr. Jen. So I will post that on my page. Instead of 1 o'clock, we're just going to go a little bit earlier. I have a full schedule that day, and then I have somewhere I have to be right at 12:30. So we're just going to do it before that. So look for that. Ask Dr. Jen. It is going to be Thursday, tentatively rescheduled time to 11:30 or 12. So thank you guys so much for watching, and I will see you Thursday between 11:30 and 12. Bye, guys.